Hi everyone, this is Dr. Kusuma from Suria Cosmetic Surgery. I want to share a new technique of skincare, skin treatment, skin rejuvenation, skin tightening that I've started doing lately. As many of you who follow me closely know, I'm constantly trying to think of better ways to do things, newer ways of doing things, combining different things to get the ideal outcome. So in laser field, there's a new function that a particular laser that I have is able to offer. The laser that I have is made by a company called Acclaro, and the name of the device, UltraClear, is the name of the device essentially, which is also a name of a treatment perhaps, but this is the term that I frequently use. So in here, I can do something called a clear treatment, which essentially improves pigment. That's why it's called clear in a sense, just to make it very simple. There's ultra, which is for skin tightening perhaps. And then you can do ultra clear, which does both of these, pigment plus tightening. And skin tightening includes pores, texture, tone, all those things, right? It's all of it. Pigment also has some of these components, but essentially ultra is a bit deeper. The clear is a bit more shallow. The two of these combines these in one treatment, and you can do that, okay? So that's what I typically do, but the interesting thing I want to talk about is coring. And the way I'll explain it to you is the following. If you have a piece of cheese that we have at the house that kids eat, we eat. It's a broad, square piece of cheese, right? If I cut holes randomly, like this, or, like this, essentially now you have Swiss cheese. Although it's not truly Swiss cheese tasting, the shape and look of it is like Swiss cheese because you've removed these holes, cheese of these holes, right? So now if I were to squish this together, this Swiss cheese left over is going to have less cheese than the original piece of cheese, right? Because if you have a broad, flat piece of cheese and you punch a bunch of holes in it, squeeze it together, the amount of cheese that you have left is less than the original because those little holes no longer have cheese. Similarly, when you do skin treatments, if you have a piece of skin, let's just say underneath the eyes, top lids, lower lids, corners of the eyes, around the mouth, maybe the jowl area, maybe the neck area, and you poke microscopic holes in a very regular, maybe irregular fashion to kind of break it up at certain density, which means how many do you compact, how far apart do you put it, like this, how many dots you do, called the percentage or density, and how deep, if the skin is this thick, let's just say, how deep underneath do you poke the hole, is also something they can control. So essentially you vaporize these microscopic holes on the surface of the skin that penetrates down deep, what we call full thickness of the skin. So you're essentially removing that skin or vaporizing it, almost like cutting out the cheese. And when you have that, you have a hole in the skin, basically, that amount of surface area, although it's microscopic. Now if you combine all of this spaced out so that it heals properly, you've reduced the amount of skin there is. And therefore, the concept and the theory and the expectation is that it's going to rejuvenate by contracting that when it closes off. Almost like when you have a wound and you close it off, it kind of closes it off. Similarly, this is going to close off and cause tightening of the skin, full thickness tightening of the skin. So if you do a broad area and you do it with coring, that's what's going to happen. And in order to do that, there's a lot of prep work that needs to be done. You have to do pre-treatment skincare. You got to do during treatment skincare. You got to do post-treatment skincare. Okay? And these are special products that we at Suria are offering as a protocol for all of these things so that we can do this safely. So this has become a go-to treatment for me in the last 2, 3, 4 months or so, because this is new technology, new concepts, new capabilities of the laser that are allowing me to use it a certain way. And therefore, I do this for patients, standalone patients who don't want surgery for on the eyes, for example, or the neck and the chin area, or the cheek area, or the mouth area. You can do it obviously, maybe on the hands, the legs, etc. You could do it in combination with surgery. Like for example, if I do a lower face and neck lift, but the mouth has these deep vertical lines that are not so good looking, we can do it for that as well. If people do the face surgery but don't do the eye surgery, or sometimes people want even more improvement, even the surgery could give, you can add this as an adjunct or an augmentation of the area in addition to surgery that can make it even better. Or maybe you could do it as a maintenance treatment 2-3 years after surgery to keep up with it. So laser coring is a very, very good technique when used with the proper settings of this laser called UltraClear. I think you'll get a very good outcome, but as anything, it depends on the surgeon's understanding, the expectations, the proper protocol, to manage and follow these patients closely. And I'm putting together a series of patients that I've done, and I'm going to be sharing those details with everybody so you can at least see what the results look like. And of course, I want you guys to understand that many times patients have to give permission for us to post, and a lot of the families that I take care of are private people. They don't want necessarily this to show, and whoever does, I am always appreciative of them because they're truly doing a service to people, to educate them, which is my purpose of doing all of this stuff. When I post on Instagram or YouTube, I'm really trying to educate as best as I can and give information. So this is called laser coring. So call the office and check it out. I think you'll be happy.